I'm going to admit 4 more people, but we have most of our crowd.
Forty-three participants.
Everybody's here, Angie.
Great, thanks, Christine. Great, good morning. On behalf of JFK Partners at the University of Colorado School of Medicine, welcome to today's webinar. My name is Angie Goodger, and I am with the Colorado Department of Public Health and Environment. JFK Partners and our program, the Colorado Title V MCH program, collaboratively present a quarterly educational series to address the current Colorado Title V MCH priorities and emerging issues. This series is intended to expand the capacity of the maternal child health workforce and related systems to better serve infants, children, youth, including those with special health care needs, and their families. Feel free to type questions or comments in the chat box at any time. Please be sure to send your chat to everyone and to make sure your microphone is muted so that we don't hear background noise. We will answer questions at the end of our presentation. We are recording today's event and will archive it on the JFK Partners website along with other webinars in this series. We've already posted the handouts for today on this page, so you're welcome to print or save for future reference. Following the webinar, you will receive a link requesting an evaluation. You may request a certificate of attendance in the evaluation. At the end of the session, participants will be able to describe the purpose of the Family Engagement and Systems Assessment Tool, which we call FESAT, and describe how the FESAT can be used to encourage and spread family engagement strategies, promote and share best practices for family engagement, and create learning opportunities among partner organizations. Next, we're going to introduce ourselves so you get to know us better. So again, my name is Angie Goodger, and I am the Pediatric Care Coordination Systems Consultant at the Colorado Department of Public Health and Environment. As part of the Children and Youth with Special Health Care Needs team at CDPHE, I support local public health agencies contracted to provide HCP care coordination, as well as those agencies that are implementing the medical home priority projects. I also serve as a project manager and our Title V representative for the HRSA grant we'll be talking about today.
Good morning, I'm Mary Jo Palladino. I'm a consultant with National Family Voices. I work on several grant-funded initiatives with Family Voices, including National MCH Workforce Development Center Partnership at UNC Chapel Hill, Healthcare Transition with Got Transition, and Newborn Screening Family Education Program with Genetic Alliance, as well as the CMC-CoIIN, which is a collaborative improvement and innovation network to advance care for children with medical complexity, and the Lucille Packard funded work that funded the development of the FESAT, the Family Engagement and Systems Assessment Tool, and toolkit materials. I'm happy to be back in Colorado and working with Angie and Lisa in their work with the Colorado CMC-CoIIN initiative and the use of the FESAT.
There we go. Good morning. I'm Lisa Franklin. I am the program manager with Parent to Parent of Colorado. We are a family-led organization that supports parents who have sons and daughters of all ages and all disabilities with information and emotional support. I'm also a parent of 3 adults, one of whom has special needs, and 6 grandchildren, one of whom has special needs as well, and I'm her caregiver. So we're excited that you're all here today. I recognize lots of names in the boxes, and we're excited to share the work that we've been doing collaboratively here in Colorado using the tool called the FESAT. Just want to remind you that we will be answering questions at the end of the presentation. So if you will use the chat box and put your question to everyone, we will try to monitor those and answer as many as we can. And I also wanted to let you know that we have designed this presentation to be interactive. So in a little while after we share some of the content, we'll actually be breaking out into 3 discussion groups. And we really want to hear from you some of your ideas about engaging families in systems change. So why do we want to involve family leaders in systems change? I think that this is something that everyone would agree to, but not necessarily approach in the same way. And often in systems and project work in the past, families and family organizations have been included at the end of a project or to give feedback on something that has already happened, rather than being included in the development and engaged throughout the project. So we really want to emphasize with the use of the FESAT that it's important to have families involved in all aspects of your project, from the beginning development through the end and the evaluation. And families can take a lot of different roles in the projects that you may be approaching. One of the reasons it's important to have families is that they really do have lived experiences that can give you great information about your project. We would never want to get to the end of a program or project and then get feedback from families that say, this really isn't very relevant to us. So if you're using family experiences and you're really using representatives throughout your project, we believe that that's going to create a better quality project. I would encourage you to look at representation of your project. If you're working with a specific target group, you want to make sure that you have families and youth, perhaps, that represent that target group. Colorado is a great example of a wide range of geographical areas. So if your project is targeting people in rural areas, you want to make sure you have that representation. And likewise, if you're targeting people in across Colorado, you want to make sure that you have representation of everyone, not just along the Front Range, which is sometimes what we see the most. We also know that families can really help balance out professional perspectives. So I've had the honor of being both a professional in education as well as a family member in the work that I do now. And I know that we as professionals can have a certain viewpoint, and families can really help us check that viewpoint, make sure it is actually what families are seeing, or help us course correct a project and say, that's really not where families want to go with this project. Overall, we feel that families really provide that critical input for quality improvement. So of course, we always want to build a quality improvement component in our projects. And again, starting with family feedback about that can make your project work even better. And then finally, we know that many of the current maternal child health projects and other research-based projects have recognized the value of having family involvement in the project. So they typically are now requiring that you have meaningful family and stakeholder involvement as you begin your project and as you complete your project. And we can go to the next slide.
Sorry about that. Okay, we're going to share just a little bit about our project. So our Children with Medical Complexity Collaborative Improvement and Innovation Network, we call it CMC-CoIIN, is a project that's supported by the Health Resources and Services Administration, or HRSA. The grant required a collaborative process and includes Children's Hospital Colorado and our state Title V teams, as well as family leaders and other community members. The project was designed to involve family leaders from the start and at the systems level. If you want to learn more about our project, the national project, this CMC-CoIIN with the underline there at the top in the title is a link, and when you download the materials, you'll be able to go to that website. A little bit about the CoIIN structure. It is a national project, and there are 10 different states that have designed their projects with their families from the very start. You'll see that it is housed at the Boston University for CoIIN Management and Supervision. We have a National Advisory Committee, partnerships with Family Voices, as well as the American Academy of Pediatrics. There's an evaluation team. We're working with Medicaid as well, and AMCHIP for the CoIIN expertise. We also have quality improvement expertise through Population Health Improvement Partners. And at the bottom there, it lists all the different states that we're working with. Colorado's project, we have named actually Coordination Plus. We thought it was a catchy title for our community and advisory team members. And again, we've worked to include family leaders from the start. We know that while tools exist to assess and design one-on-one interactions with families, there previously hadn't been a tool to assess the systems level of work. And so part of our project with Coordination Plus was to include that systems level tool. Coordination Plus, again, is that collaborative project, and our goal has been to advance the care of children with medical complexity by improving communication and collaboration between specialists, primary care, and the family using a co-management approach. And so a lot of our tools, again, have gone are to communication, and some of it is technology as well. And again, if you want to learn about that, you can go ahead and check the website. One of the things that we felt was important with this was really from the very beginning building that advisory team. And we chose to have very broad representation and making sure that our teams and partners were bringing different skills and lived experience, that they represent different regions and communities around the state, and are both state and community based. And so we have our family representatives that include parents, youth advisors, as well as groups like Parent to Parent Colorado. We have community-based primary care providers. We have staff, including clinical, administrative, and care coordination teams out of Special Care Clinic at Children's Hospital Colorado. We have a quality improvement specialist that works within the Child Health Advocacy Institute at Children's Hospital Colorado. Our state staff, as well as, again, that QI coach and the BU staff supporting our project. The goals of our project were really to increase statewide PCP capacity to manage that medical complexity within the medical home, addressing access and equity for families that live at a distance from specialty care, and align medical and family goals using a shared plan of care. So that communication piece involves a little bit of technology as well. The other piece that we thought was important was really that family focus. So again, how do we keep care local? Can we reduce barriers like missed work in school or travel costs? Can we improve that communication between families and their providers and keep everyone on the same page and do it with, and create that design with family input? Okay, Mary Jo. Mary Jo, are you muted? Can you double check?
Thank you. Oh, sorry about that.
There we got you. Thank you.
So a good place to start is the definition of systems level engagement when we're talking about this tool. It was designed to assess family engagement at a systems level like Colorado's CMC-CoIIN initiative, Coordination Plus. And so we started with the definition before we developed the tool, and you see it here. We're talking about authentic partnership between professionals and family leaders who reflect the diversity of the communities they represent, working together at the systems level to develop and implement better policies and practices. There were tools available for assessment at individual levels, more at the direct care level. However, we found there was a need for a tool to assess at the systems level. So in the next slide, you'll see the tools that were developed, the assessment tool itself, a user's guide, and the toolkit. And I hope everyone had a chance to download these materials. I think before the webinar, we sent information to do that. So if you haven't been able to do that, I would encourage you to. So in addition to the actual survey tool, there's a user's guide which walks through how to use the tool, scoring the responses, and how you would use those results. The tool itself is organized around 4 domains of family engagement, which are commitment, transparency, representation, and impact. There are about 20 questions in total, 5 questions each for the first 2 domains, 4 for representation, and 6 for impact. Next slide, please. And there are 3 ways to think about the uses of the tool: to assess, to improve efforts, and to guide. So I'd like to talk a little bit about that. It's assessment, or assessing how well an organization engages families. Both staff and family members use the FESAT to assess a completed or an ongoing initiative. Improving efforts, think about quality improvement. Improve efforts in an ongoing effort over time, a quality improvement approach. Take it to establish baseline initially, and then maybe at intervals of 6 months or a year. As we know, many systems level efforts happen over a longer period of time, not just in a few short months. And then the third approach would be a guide to the design of systems level initiatives, where organizations just beginning to engage families in systems level initiatives use the FESAT and the toolkit to guide the design of an initiative to help ensure family leaders and staff have the supports that they need to understand and to succeed in their partnership roles. So on this slide, you'll see the checklist, and I think this may have been sent out ahead of time too. It's the same questions as the full assessment tool, only abbreviated, and it's designed to be that guide as you're beginning an initiative and maybe haven't involved families in a process like this, to give you ideas on what types of supports may need to be in place, again, to help families be successful in participating. And then in the next slide, just briefly about levels of family engagement. And I know you know this already. There are different levels of family engagement, but our focus again for this tool, the FESAT, is the systems level work, organization design, role in policy making, or creating and improving policy. So in the next slide, you'll see to begin taking the FESAT, what the team does is writes a short description of this ongoing effort or recently completed effort, so that everyone that's taking the FESAT has a clear understanding of what the effort is that they're talking about. So this would be your family leaders and staff representation of an organization or organizations. So for example, the Colorado initiative, there are multiple organizations involved, right, in addition to family leaders. So that team uses a description that they all agree to on what it is, what their effort is, and then in their role as a family leader or staff person answering those questions, they reflect back on this description as they're answering it. They've also identified their role. Some serve multiple roles, but so for example, family leaders who may be in a staff role as well as a family leader role, and their role on the specific effort that they're answering the FESAT to, they identify as, they choose either I'm in this staff role in this effort or I'm in the family leader role. So in the next slide, I think we've included the Colorado example to give you an idea. We put together this template with prompts to help teams guide their effort in describing briefly in a few sentences what is the effort that we're going to assess. So you can see in this example, Coordination Plus is the name of the effort. This team engages families, providers, and care coordinators for input and feedback in the co-development, co-management interventions as part of Coordination Plus. So let's go to the next slide. What we would like to do is take a moment and invite you to write out an example of maybe an effort, a systems level effort that you're involved in right now, or one that has maybe recently been completed. And so I would encourage you use the chat box to enter your information, ask questions, but just briefly pause and think about an effort that maybe you've recently finished or you're doing now. Write the name of the organization. So the example you just saw was Coordination Plus. Engages or engaged families in, and then write a sentence and share it with us of a description of your initiative. Could be an advisory group. I'm watching chat for examples. Okay. Let me see. Hi, I'm Service Coordinator for Early Intervention with the Colorado CCB. I'm so excited to see how this can expand resources for early intervention families that are in Part C and also transitioning to Part B. Thank you. Thank you for sharing that. Others, anybody want to share? Okay, see another one. Rebecca, thank you. The Early Childhood Council engages families using the community cafe model to collect community input about a topic of interest in their neighborhoods and then take action with the collaboration of partner agencies. Oh, good. Thank you for sharing that. And Christy, we are using the FESAT tool with the NicheQ ECCS coin. Thanks, Christy, for sharing that. Okay. North Metro Community Services, Inc., Adams County CCB, and I am an NICU coordinator. Oops, it's moving too fast for me here. I am an NICU NICU coordinator, and we are working on partnering with hospitals and families before discharge. Thank you, thank you. HCPF engages families, attempts to, on the Children's Disability Advisory Committee. So HCPF group, using maybe the guide, the FESAT guide, if you're not having success, is maybe a starting point of looking at things to maybe put in place. Okay, I see another one from Tiffany. Hi, I'm the Executive Director of the Rocky Mountain SIBs, and we run a sibling leadership program called Allies in Leadership Policymaking and Systems Change that seeks to empower siblings of individuals with disabilities to become involved in systems level change. Thank you, Tiffany, for sending that. DCSD, engage families in collecting communities' input about top priorities for students to increase opportunities, social emotional learning for all levels of students. And another one, the Department of Healthcare Policy and Financing, HCPF. Oops, I lost it. Okay, I'm having trouble here. Okay, Mary Sundlin. I'm a care coordinator with HCP. I am on the Arapahoe County Early Childhood Council as parent representative to inform us on the parent perspectives as we compile resources for providers and families. Another good example, Rochelle. I participated briefly with the group in Kentucky and their cafe ideas were great. Had some trouble getting families to engage when the children and had complex needs and caregiver support. Distance, transportation issues came up. Okay, all very, very, very good examples. And so using these types of initiatives, gathering the team of organization representatives and your family representatives, starting with that brief description of what the initiative is, you can use the FESAT tool then to individually answer the 20 questions from your individual perspective as a staff or an organizational staff person or family leader. You there are 2 or 3 ways to do this, and you'll hear from the Colorado example how they did it. But the family leaders then can compare their ratings and results, discuss it, and come to consensus and a consensus score on each of these areas. Organizational staff representatives doing the same, and then the 2 groups, family leaders and organizational staff, coming together as a whole, discussing the results and where there's disparity, looking at can we come to consensus on it, moving the score up or down. What are we learning from this scoring, the different perspectives of each person or individual that takes the assessment based on the initiative that they're talking about. And this information then helps inform kind of next steps or action steps that they might want to use to improve family engagement or get family engagement started where they're having issues on even getting the involvement. So with that, any other questions? So let's then transition. Yeah, I don't see more in chat. Let's transition to hear more from Angie and Lisa about Colorado's process.
Great, thanks, Mary Jo. So our experience with Coordination Plus in Colorado, these are the steps that we took to get our process moving. We worked very hard to ensure representation from all of the different groups or individuals that were participating on our advisory team. So a care coordinator, administrators, primary care, we had family members, siblings, and youth advisors as well. And so once we'd established that group, we actually individually completed the FESAT tool. And of course, encouraging everybody to be candid and really thoughtful. We also had to do a couple of reminders that this wasn't a grade, that this is a tool that we wanted to use to move forward and to just really understand the quality and sort of the direction that we might go to increase partnership with our families. We met twice and negotiated and worked through, I guess negotiated might not be the right word, we discussed the scoring and we tried to understand the differences between family scoring, community partner scoring, and of course also our clinic staff scoring. During that time with the discussion, we actually changed our scores a little bit. We came to a consensus on what those might be and started to narrow down the potential domains that we might be working in. Our action team work group landed on 2 different domains and continued our discussion there to really understand what about those domains might we work on and what was the really important pieces and the root causes. Once we determined the domain, the action team work group drafted potential activities that we took back to our advisory team and then worked on action plans and moving that piece forward. Throughout the process, we relied heavily on the FESAT toolkit that includes different strategies and intervention ideas that we might be able to draw upon and adapt in order to meet the needs of our group. So our experience really designed with family engagement again in mind from the beginning, but we weren't really sure how to assess the work that we've been doing and how to move that advisory team more to an action team. So there really is a difference in the design piece between whether you're just advising and listening or actually giving input on the process and helping to design it. So we knew we wanted to improve our family partnerships, and our shifting from advisory to action really happened as we discussed and realized the value of that discussion, as well as sharing our survey data openly. We worked to strive for common understanding, and again, we had multiple discussions around scoring. We dug deep for the root cause, and as a group reviewed our data and continued to talk about that data. As we explored those opportunities, we continued to look at the strategies and resources provided in the toolkit, and again, worked hard to adapt those ideas to not only fit our team, but also the organizational culture, and make sure that they were aligning with our desired outcomes around family involvement, as well as alignment with the other interventions that we were already working on within the entire CoIIN and Coordination Plus project. And again, designing and testing those interventions with our families from the start. And that's a shift, I think, for a lot of organizations. You know, sometimes we'll work really hard on a project and get it designed, and then we bring it to families and realize, as Lisa mentioned earlier, that didn't really meet their needs and wasn't as meaningful as we had hoped it would be. I mentioned that we had identified 2 domains, and so as we discussed, we realized that we actually we had representation as one domain, and so that's really occurring when the family leaders reflect the diversity of the community served by the organization. And we also had commitment, so meaning that the organization would routinely engage family leaders in all systems level initiatives that affect the policy and programs for those families. And so what we did is we discussed and we realized that if we worked first on our commitment, we would have, and the root causes around commitment, we might have a better opportunity to improve on representation. And so while we selected 2 domains, we decided that we wanted to set different benchmarks and take small projects and have them add up over time as we work towards implementing interventions for both domains. I'm sorry, we have a few notes here too. Again, that important part of that process we really felt was around that discussion and working together to truly understand those different perspectives. I mentioned in the toolkit that it actually has a section for commitment here around strategies. And so the strategies that they shared talked about creating written policies that require engagement at systems level, ensuring the organization has 1 or more champions of family engagement, provide mentoring and support to ensure families and staff understand their roles and can participate as fully as possible, that they have a mechanism for reimbursing family leaders for their time and other costs as they occur, and creating a mechanism for documenting and reporting how those families have contributed to systems level initiatives. So we saw these strategies and we talked them through, and we were actually really happy to see that we felt like we were on the right track. We were trying to be sure that we always reimbursed family leaders for their participation. We've been working hard to document and report out on how family leaders were contributing. We knew that we had champions within our clinic structure and within our organizations that wanted to see meaningful family engagement and partnership. But what we didn't have was anything written that talked about how would we do that and how would we ensure that families continue to engage and engage at a systems level. And looking at those, we knew that we might not be able to do them all, and that we might be able to improve in some areas. But what we really felt was that we needed to adapt that first idea, that first strategy, because policy change in an organization can be a really big process. And so sometimes it takes a while, and we didn't want to wait too long for that change. And so what we decided was that instead of a written policy, we would actually just start with a value statement, and we would work with our special care clinic team members and families to develop together a value statement that talks about how we wanted to engage and work with families around our systems level initiatives. So we adapted what we found in that toolkit. We looked at the strategy ideas and really tried to make them fit with everything. So really a jumping off point, which I also feel like makes people feel more confident and comfortable. It's not that you have to do something really, really specifically. You can design it to make it work for your team members. So the outcomes we decided on was that we wanted families that they would be routinely and consistently engaged in special care clinic design, change and improvement strategies, and that we would, both families and staff would understand their roles and have the tools, skills, and knowledge to participate fully. So as an action team, right, so this is that smaller group of our advisory team, we looked at our outcomes and we developed an action plan where we figured out what might our strategies be. So how can we make those two outcomes happen? We decided who could be responsible, who could help, and we started creating a timeline. The other thing that we felt that was really important was that we divided up the work and really took it on as a team. So no one person was doing the work, and that our family members were an integral piece of that. And so you'll see here, I used titles for each of the strategies that we wanted to work on. This is a snapshot, so the work plan there's more to it, but this gives you just an idea how we did that. And then we also made sure that we partnered with families and to identify what support they might need around the different activities and actions that we needed to take in order to have to be successful. One example I wanted to quickly give as far as the data that we looked at and how we might work differently with families is that as we've done this, we've started to identify projects that we are working on and that the clinic was working on that we could pull family members into sooner for their input. And one of the requirements of this grant was that we actually survey our families that are enrolled in our project. And we found between families and providers that there were several words within the survey that maybe the definitions were not commonly understood. And the providers thought the scoring was a little bit lower than what they would have liked to see. So we talked about opportunities, just like defining and creating that value statement, but what other opportunities might we create where we can talk with families about those concepts and understand better how would they want to talk about those concepts, what words would be more meaningful to them, and how might we change the language in our survey and also the language we use when we're one-on-one with families to be more engaged and to talk about different issues that families might be facing. I think that's it from that perspective. Let's see what we have next. Yeah, let's go ahead and go into our discussion. Lisa, are you there?
I'm here. So what will happen next is Christine, who's our magical behind the scenes coordinator here, is going to put all of us into 3 different discussion rooms. And when you get into your discussion, we have these particular questions that we would like to present to you and hear some of your feedback about how projects that you've worked on have engaged families. So momentarily you should be moved to your room. We have about 20 minutes for this discussion overall. It was helpful. We'll pause just a minute here to get everybody back together. All right, looks like we have more people coming back. I really like this feature of being able to do the breakouts and get some additional conversation going. So thank you for everybody who shared a comment and participated with us in this section. We are going to ask for each group to share a couple highlights of their discussion. So if you have something you want to share, or if the person facilitating your group wants to share, that's kind of.
Can I also interrupt real quick and ask that they press record again?
Yes.
Because I don't think it's, yep, there it goes. Okay, good.
Okay. Awesome. And do we think we have everybody back, Christine? I'm trying to see if we, okay. We may have.
Sorry, yeah, everyone should be back. You're good to go.
Okay, thank you so much.
Yep.
So let's just spend a couple minutes with each group, and if you could let us know a little bit about what your conversation was like, and did you come up with any great ideas for using the FESAT or for engaging families? So I'm not sure of those of us who led the discussion. I know I was group 2. Angie or Mary Jo, who was group 1?
Landed in group 1.
Okay.
So I must be the other.
You are 3, Mary Jo. Angie, do you want to share a little bit about your group discussion, or do you have somebody in your group who wants to share?
I don't think we identified anybody, but I think I'll give a couple of sentences, and then if they want to add on, please feel free to. We talked about just the value. I think a lot of people spoke of the value of having different organizations and families talking together and working together to identify different interventions. I also heard a lot of people saying that, you know, I like those strategies. I would like to try to do some of those. We talked a little bit about the approach. You know, would you try to pick something from every domain? Would you, narrow it down further? What might that look like? We talked about just the complexity of some organizations and where to start as far as impact and making change. And I feel like there was one other thing that was really, the definition of family. So common understanding and definitions are important. And so when we talk about family, let's talk about family. It's not just a caregiver, but who else might be a part of that team and in it for the long haul, right? To help support that family member. So those were the things that I heard. And I know I wasn't in the room immediately, so I probably missed. So I would invite anyone else from that room, if you'd like to share anything else very quickly. I think we have time for a couple of comments. If you're talking, you're muted.
Okay, and I cannot tell if anybody is trying to share right now. Kathleen, did you want to share with us a little bit?
Yeah, our group just briefly talked about ways that it could be implemented within schools or within teams one parent shared a story of possibly using this type of methodology of domains and scoring with medical therapists, teachers, just trying to get everyone on the same page. And then I discussed possibly using it at HICPUF, where we could implement it in a couple of different ways. And then once we would get the scoring back, Angie talked about kind of how they prioritize certain strategies within the domains to really highlight one thing at a time, get that work underneath them, you know, like a solid foundation, and then moved on to some of the other strategies within those domains. So I really liked that idea to try to take this large work and break it down into small pieces.
Yes. And that's what we would encourage you to do, because as a tool, it could seem a little overwhelming altogether, but if you can break it down and really prioritize what you want to work on first, that's a great way to approach this. And we talked about that a little bit in the second group. At the end of our conversation, we were talking about, you know, who are the champions around family engagement and family change in systems, and how do you start by identifying either yourself as a champion and then recruiting other champions, but eventually getting to the level where decision makers are listening and to the families and the input that they're giving. We also talked about some great examples of where families have been engaged in local projects, and I appreciated everybody sharing those. Several early childhood examples, the Adams early childhood effort that led to their family resource center was shared, and that was great. And they're still engaging families to get input. And the other thing we talked about a little bit about are what are some of those barriers to making sure that families have access to the projects, that they can be compensated when there's a mechanism for that, or how do you provide other incentives if there's not a mechanism for compensation? So I appreciated everybody sharing both their thoughts and also their issues that may be a little bit of a sticking point, and how can we problem solve around those. And then several people, Christy, you'll be interested to know, also suggested that this could be used for the Disability Advisory Committee. So yes, on that one. Does anybody else from Group 2 want to make a comment on our discussion?
I am more than happy to incorporate that in our work. There weren't any parents yesterday on the call, but yes, we will do that. And yes.
Did you open the door?
Good potential for the future.
Oh, thank you.
Okay. Mary Jo, do you want to share your group discussion?
I'll start off with a couple sentences and invite then others to add. I'm having a little bit of intermittent connectivity, so I hope you can hear me okay. One of the disadvantages is for those who didn't have the opportunity to download the materials and look at them, it's hard to talk about them if you're not familiar, right? But one of the topics that came up in this kind of effort, participating in systems level work or advisories, is the inconsistency and inability oftentimes to get cost reimbursed or support financially, and being time away from work or whatever. So the importance of efforts looking at, you know, how do we build within the budget of this effort, being able to compensate our stakeholders so that we do have true engagement. And then what happens when, you know, if it's a grant-funded effort, once you start something, how are we able to sustain it over time? So the importance of having a way to talk about and figure out how can we truly, you know, figure out appropriate and equitable compensation for the participation, so for equal team members, right? So others want to contribute from our group?
I thought the discussion that Bob was talking about at the very end is critical. I always talk to the teams that I'm working with on parent engagement around, don't invite the family for dinner and then give them the time when you're already having dinner and you've missed the cocktails and all the open stuff. You know, invite them at the beginning of the project. Give them enough information so that they're sitting there, and it also informs the budget. It informs all of the project, and the families then feel like they've really truly were invited to the whole dinner, not just half of the dinner, when everybody, you know, because often teams say, oh, we've got to get our ducks in a row before we get the families at the table. And actually the families, I've never seen a table where the conversation didn't change significantly when the family was sitting at the table, and the conversation changes because the family's perspective is so valuable and brings light to the community, et cetera. So I really feel strongly that we need to engage the families, but early on, and ensure that there's enough money in the budget. And I always do the caveat of don't think about benefits, make sure that we don't knock them off benefits by giving them a stipend that puts them over that. So it may be creative, Walmart gift cards, places where you can get food, places where you can get essential supplies, things like that. Whatever they need. That's it.
Thank you for sharing that, Christy. And I think that is important. We sometimes have to think outside the box about how we're engaging families and compensating families, and actually having families there with us to do that can make that process a lot easier. The other thing that Mary Jo had mentioned as a starting point with the FESAT is there is the checklist that's available as you're planning a project to really go through and see what are those areas that you have some good plans in place and you know how you're going to handle those areas, and then what are the areas that you may need to be getting some input from families about. So I would encourage you to also take a look at that checklist in the toolkit. It's really meant to get you started in a project or started in an effort to be able to figure out how do we engage families effectively.
Hi, Lisa, I just had one more thing to add, Stephanie.
Yeah, absolutely.
There's a whole lot of case managers out there and a whole lot of service coordinators to get this information input from families when they're really sharing a lot anyway with us of what they don't like about what's happening or what they do like. This is kind of an odd thing, but I really equate myself as almost families' bodyguards, their bartenders, their ear listening, because they really let us know a lot. So really into these CCBs and training the caseworkers for how to work with these families and get this information, I think would be so valuable.
Mm-hmm. And so you guys as service coordinators or caseworkers really do become those champions for family engagement. And I would encourage you to think about then who else can you coalesce with to say, you know, we're hearing from families that these are some issues in our system. How do we move this forward? And how do we come up with a system that will really work? I think one of the great benefits of the FESAT is it's not meant to be a test. So it isn't that you're going to get a score like we're doing this 100% of the time, yay. It's really meant to be a tool to help any kind of a system analyze how are they doing things, where could improvements be made, and starting with families as part of that discussion, I think could really lead to the changes that families are interested in seeing in any system. So I would encourage you to take a look at the tool itself, take a look at the strategies in the toolkit. I'm going to give a pitch for engaging Mary Jo because she was critical in developing the FESAT. So if you do have questions, technical questions or other questions about how to use it in a project or an organization, we are very lucky to have her in Colorado and to be able to tap into her expertise around that. Yeah,
happy to do that.
I think we'll move on to some questions and answers. And again, we would love for you to put questions into the chat box so everybody can see them. And we're going to do our best in the next few minutes that we have, about 15 minutes left, to answer as many questions as we can. And if there are some things that we can't answer right now, we may try to circle back with you and give you some more information later. So I am going to scroll through and see the questions that I can see, and then Christine and Dina are going to help me with this as well, so we try to get as many covered as we can. We had a question earlier about just education-wise and in general, where are families able to give input into how things have changed during the COVID crisis? And so for those of you who are in an education agency, I would be interested to know too, if there is a mechanism for feedback from families, if that's something that school districts have been doing on a regular basis, to your knowledge. I will share from my perspective, because I have a first grader who lives with us, and we've been doing homeschooling for the last 8 weeks. One of the things I've really appreciated is that the first grade team that's designing the lesson plans does ask for feedback every week. And they're, it's very basic questions, but it's basically, what went well, what was a challenge, what else does your kiddo need? And just to have that consistent weekly conversation with teachers, I think has been great from a parent caregiver perspective. And it's also led to additional things that we've put in place for my granddaughter in terms of supporting what she needs during this time. So I'm just curious if anybody wants to share something that their educational setting may be doing. Okay.
So hi, this is Missy. I'm with North Metro Early Intervention Program. And one of the things that we've been doing since everything's moved remotely, and we're working with children birth to 3, getting them in front of a screen can be a little bit challenging. But one of the things that at the state has done is created sort of like a passport with parents and inviting them to like hours to come and attend to share how telehealth and services are going for them.
Nice. Excellent.
In early intervention as well, we have set up a crisis management fund, and we're asking families how that's impacting them right now, and then if they're still in need of funds. So that's kind of a questionnaire. It's the only questionnaire I can think out that we're sending out right now, is how that's helping them.
Great. Okay, moving on to some of our other questions. Rochelle was asking about, I think your question, Rochelle, is kind of how does person-centered planning fit into this scheme of family engagement? And certainly the person-centered planning process does involve families. I would say it's different than the FESAT process, because person-centered planning, if you're working with the individual and the family, is really centered around what does that family member need, or what does the family do to help support those needs, and then also how the system can help support that individual family. The FESAT is designed to be more of a systems change effort. So if we were going to think about, is person-centered planning working in Colorado, or is it working the way we want it to be working in Colorado? A project could be designed to really look at how are families engaging in this as a policy process, and what are the things that are working well or not working well or might need to be changed. So I could see the FESAT intersecting in terms of quality improvement around how person-centered planning is being implemented in Colorado. I know we have a couple of folks on here who are experts in person-centered planning, so I'm not sure if they want to jump in with their observations about this or not. I could call on Bob Lawhead. All right, Bob, I don't see you responding, so I'm going to move on. But if you want, oh, there he is.
Sorry, I'm trying to download all the FESAT documents now. I hadn't
That
gotten
may
to that
take you a
before.
bit.
So Lisa, I'm sorry. I don't consider myself an expert in anything, but so I'm not sure. I'm sorry. I'm not sure what you're asking.
So the question was kind of referring to how does person-centered planning fit with family engagement or with the FESAT process? And knowing you're just being exposed to the FESAT now, have you had any thoughts about that?
Well, I just love the first section. The commitment section looks great to me. I mean, that's something that I just do not think we do proactively enough in state government right now. And so, yeah, I think for the Colorado Developmental Disabilities Council, considering that our mission is to engage families and self-advocates in policy work and policy implementation, this may be a very, very useful tool. So I'm just sorry I didn't prepare better and download it prior to the session.
It's okay. We're glad to hear you're downloading it now. Thank you for sharing that. Gloria is asking, what are the structures for covering the time for this type of systems planning? And how can critical stakeholders, doctors, clinicians, educators, family members all come together for planning and communication? And how would that time be billed? So I'm going to shift that over to either Mary Jo to maybe give us examples of how that's being done across other organization efforts. And Angie can maybe speak to how that happened in the Colorado CoIIN.
So this is Mary Jo. I can give you a few examples of what we saw in the different pilots. There were different groups who met on a regular basis, and what they did is built in time during those normally scheduled meetings to do this. Once you identify the team of family and staff, organizational staff who are going to take the FESAT, people can individually take it and then come together either virtually by phone or pre-COVID, people actually met at normally scheduled meetings. That I think maybe Angie could speak to like what their experience was time-wise for the discussions and then some of the post work. But the FESAT itself is 20 questions. It doesn't take very long. And again, there are 2 or 3 ways that you could do that. I think I had mentioned earlier, like the family participants that are taking it, take it individually, then together talk and come to consensus. And then the same with staff. Look at their individual scores, come together, come to consensus, and then family and staff come together. In other cases, the whole group did it individually and then just came together to talk about their scores and come to consensus. So Angie, do you want to speak to that?
Sure. So with our CoIIN project, our Coordination Plus, we had the luxury of having a grant that allowed us to do that. And so from the very beginning, we budgeted gift cards in the appropriate amounts for well, we tried to do the appropriate amounts. It maybe could be a little higher. We're working on it. But we had a nice line item for that piece. We also ensured that we had some funding to provide dinner, because that's typically when we are meeting in order to get primary care, specialty care, and families all in the same room. So as Christy Blakely mentioned, you know, that budget piece is really important. But as I also said, we had a grant for that. One of the things we've talked a lot about is how do we institutionalize, normalize it while we do have some funding and get it built in to the system that we're working within. So trying to figure that piece out, I think, you know, once you normalize it and you bring it into the process, it just becomes second nature to be doing some of the other items. And the other thing that I wanted to mention was that for some of our participants, it was less about the budget and more about the impact and change. So we are really, really blessed and lucky to have people on our advisory team and our action team that think this is really important, and they show up and they participate and do homework in the middle, and they've been with us now for 3 years, and they continue to come back and do that. And so that it's really amazing. Despite everything else that's happening, that they keep coming back because they see the benefit. They know what the win is for them, and they wanna see that piece through. So we've really had a lot of that that's happening with this group as well.
Thanks, Angie.
May I
Christy,
jump
I
in?
saw you raise your hand. Do you want to comment as well?
I wanted to communicate that I put up 2 documents. That one is a stipend for parents. It's kind of, I mean, it's a template. We used it in one of our work niche Q coins. And then a parent family job description. Again, templates, use them as you need to. There's nothing special about them. Anytime you start putting down dollars, everybody gets a little funny, but just some ideas and starts for everyone.
Thanks, Christy. I also made a note for myself. There was recently a publication, and I don't remember where it came from, but they actually looked at, what is considered reasonable reimbursement for time for families. And I think we can find that and maybe have JFK Partners share that out as well. But that was it was a nice tool as well. So we'll be sure to do that too.
And Mary Jo, I think you posted a tool as well. Do you want to talk about that real quick?
Yes, I posted a tool that's actually in the toolkit. It's on page 8. It's under the first strategy. And even though it's a standard of compensation for youth and family partners, and even though it was written for the research setting, it applies to all settings. So it could be a very helpful guide for you.
All right. Thank you so much. We're going to just have a couple closing thoughts here, but I would invite you, if you do have questions or ideas that you want to share, all of us, Mary Jo, Angie, and I are all available, and certainly would welcome engaging with you further around this. So just to kind of wrap it all together here, we really do want to encourage you to involve family leaders from the beginning of your project, and to think about how they can help you problem solve around some of the barriers around engaging families. And I think what Angie said was particularly important, not just related to compensation, but once this becomes the standard or the habit in your organization, it gets easier and easier to do it. And the barriers, I think, seem less and less. One of the great advantages of using the FESAT, and we do hope you will all download it and take a look at that toolkit, is that it has some very concrete strategies. So whereas the whole idea of how do we engage families in this project can seem fairly overwhelming, if you start to really work through some of those checklists and some of those strategies, we believe that you'll find that some things will seem very achievable. And you may even see some things that you already are doing that you either want to tweak or you want to say, yeah, this worked before, we want to continue that. The other thing that we found in the CoIIN project is that really made a big difference was doing this tool and coming to consensus around how we would score the efforts of the entire project. The discussion was just incredibly valuable to find out where different people on the team were coming from, how they saw things the same or differently. And so really using the tool as a jumping off point to start a discussion in your project would be something that we really would encourage you to do. And then you can really come up with a plan that seems achievable. And then the other tip we would have for you is really document your process. We took a lot of notes as we were trying to come to consensus around the scores on the FESAT, and the intention is to use those notes and those ideas when we do this tool again, so that we really do have a good idea of why did we pick that score before, and why did we choose to focus on that strategy, and then what's been the results of that action planning for a group.
Lisa, Rochelle is asking, how do we, the participants today, how do they stay connected with this great work moving forward, and stay connected to the conversation of policy change? And I think, you know, this has been a rich enough conversation. You may want to consider another one. But for sure, what Rochelle said is true. We need to keep this work going forward and having the conversations.
Absolutely, absolutely. And what we hope is that you all become champions for family work in systems, and that this tool really helps you do that. It gives you something tangible to move forward. So whether you are working in a Head Start program or an early childhood program or a CCB or in education overall or in one of our state systems, or even just on projects maybe locally, we would encourage you to start incorporating this. So thank you so much for being here. This is a great picture of our CoIIN team celebrating. Everybody was able to be king, queen, or princess for a day during one of our meetings, and Angie's great about documenting the efforts of the team. So we really appreciate your participation today, and you will have an opportunity to review this webinar at a later point when it's posted on the JFK Partners website. So thank you so much for being with us.
Thank you.